That
Get in there, yeah.
I know the jail button right up to that administration building.
Everybody, I think we've gotten to the right time and the right number of people
Yes.
all together, so we'll go ahead and get started. And we will start with an acknowledgement that we're getting used to new technology. That's very fun and exciting, and just we'll all bear with it together. But I think it's a really cool step forward that's being made. So first, I think our only virtual attendee who you actually can't see is Jennifer Bargy. Hi, if you can see us. Thanks for being on while you're out of the office. And do we have any non-board, and we don't have people to introduce tonight, do we? Except for our special guest, who will come up in a moment. Yeah. And everyone, please remember to sign in. Thank you very much. Can I get a motion and a second for adopting the consent agenda and last meeting minutes?
Second.
And then second. Okay, 2 seconds. Thank you all very much. Is there any question or discussion about either one of those? Or really just the minutes? No? Okay. So then all those in favor, please say aye.
Aye.
All opposed? Okay, so the motion passes. And now we'll go right into this month's presentation, where we've got Julian and Justin from the amazing public health staff here to talk to us about what's going on and what they're seeing in the community health assessment results.
So, thank you, Sylvia. My name is Jillian Drew, and I am the accreditation coordinator here at Greene County Public Health. And this is Justin Moon, and he is our data analyst. And we are going to talk to you today about our community health assessment and community health improvement plan. So just a quick overview of community health assessment. Identifies key health needs and issues through systematic, comprehensive data collection and analysis. Here at Greene County Public Health, we use the MAP 2.0 framework, and that is mobilizing for action through planning and partnership. It's a community-driven process. It conducts 4 surveys. One is a community survey, one is a community partnership survey, and then we host focus groups. And we have a work group called Growing Healthy Together Greene County that is combined with a ton of different community partners. And then we have our community health improvement plan. So this translates the health assessment findings into action steps. It creates a strategic roadmap outlining goals and measurable objectives to improve the overall health of our population. So we are, these are 3-year cycles, and we're entering into our last year for our 2023 CHIP. So these are just the current priority areas. So we have access to care, health behaviors, mental health and addiction, and maternal and infant health. The organizations that are leading these efforts are Greene County Public Health, Green Cats, the Mental Health and Recovery Board of Clark, Greene, and Madison County, and the Greene County Educational Service Center. And so I real quick just want to highlight some of the amazing work that we did in 2025. So Green Cats secured funding for a transportation directory that'll be issued this year in 2026. They also implemented a new flag stop at the Fish Food Pantry. And for our dental health, we've increased social media outreach through Greene County Public Health. Under health behaviors, Greene County Public Health launched a farmers market in Xenia, and we worked with the city council in Fairborn and helped them to develop an active transportation plan that has since passed. It passed their council in July. For tobacco, we have done education at schools in Greene County, and we also co-hosted a youth advocacy color walk. Under mental health and addiction, the Mental Health Recovery Board works with TCN, who runs the 988 crisis line in Greene County. And in 2025, they answered 5,298 calls. They've also partnered with Coleman Health Services, who is their regional provider for their MRS program. The Greene County Educational Service Center continued efforts to provide multi-tier prevention, intervention, and consultation services for children ages 0 to 8. Greene County Public Health extended naloxone access. They purchased a new mobile unit that you can see out back. It's really exciting. And they also increased their reach by 18%. And then our maternal and infant health work group here at Greene County, we launched a infant mortality database dashboard that you can find on our website. We hosted our WIC baby shower for the first time since COVID in person, and we had 100 and almost 30 participants come. And we gave away 82 car seats and 77 cribs last year. So lots of great work was done. So our next steps in this, in our community health improvement plan, we're in our CHA process. We're currently in the final stages of completing the draft report. On the 22nd, we'll be meeting with the work group again at OSU Extension's office to divide into work groups and dive deeper into our projected priority areas. We'll then move into finalizing the CHA draft and getting that out to the community, and then writing our community health improvement plan. And meanwhile, that's going on. Our work group for the current CHIP, we still meet. We met last week and we're continuing to meet quarterly. And then just to show you for accreditation purposes, and this process, we align with the state's health improvement plan. So this is their last health improvement plan framework. And you have to, per accreditation, you have to align with at least 2 strategy areas. So we aligned with multiple areas, and their SHIP has not been released yet, but it will be the same priority areas. They might be adding a couple, but it'll still be this. So, and I will turn it over to Justin.
So we've got a lot of data that I'm going to try to share with you in a short amount of time. So first, looking at the demographic makeups of the county, on the left is the ACS data, about majority white county, even distribution of the sexes, and relatively even distribution of the ages. In terms of who actually answered the survey, it was about 90% white adults, with the rest being Black and other races, about 2/3 female and the rest male. Ages, just under half were middle-aged adults, and the rest split between younger and older adults. In terms of asking people on the survey what they felt the main issues and needs in the community were, 50% of them responded as mental health being the primary health issue impacting their community, followed by obesity, substance use, and cancer. In terms of insufficient health services in the community, mental health again came out in first, followed by substance abuse or misuse. Other notable ones included primary care, oral health, family planning. In terms of top community issues, in a more general sense, over half of respondents said affordable and safe housing was an issue, followed closely by affordable food and then by employment opportunities, with other lower responses being things like elder well-being, youth well-being. Looking at people's overall health, what we saw in some of the focus groups is people stating things like how health scares prompt people to go actually get services and get help for things, or get involved in health activities. When we look at the leading causes of death in the county over the past couple of years, it's remained the same, with heart disease, cancer, cerebrovascular accident, and chronic lower respiratory diseases. When asking people how their physical and mental health affected their ability to do regular activity and live their life, about 17% of people were affected by their physical health, with Black adults being less likely to be affected. And in terms of mental health, about 16% of people were limited in their regular activities due to that, with younger adults being more affected, as well as those with a high school diploma or less, and low-income households, specifically under 15 and 25 to 35,000. Looking at fall data, by far the highest age group with fall incidences is older adults, with women slightly more likely to have falls and over twice as likely to go to the emergency room after a fall, with men being more likely to have limited activity. And notably, Greene County has much worse fall mortality than the state and nation, with Greene counties being just under 20 deaths per 100,000, whereas the state sits around 14 and the nation just over 11. Looking at behavioral health, some things we saw in the focus groups were that mental health needs more investment and attention, and focusing on addressing the underlying issues that cause people to seek these services to begin with, like housing issues, family, unemployment. And again, based on people's perceptions, mental health and service needs are a top priority. Looking at rates of anxiety and depression in the county, a bit under a quarter of respondents to the survey were diagnosed with one of these conditions in the past 12 months, with younger adults being more likely to be diagnosed, anxiety being significantly higher in females, and both of these being much higher in low-income households. Looking at availability of providers in the county, Greene County has more providers than the state in terms of psychiatric physicians and specialists, but there are less mental health centers and treatment facilities available in the county. And looking at substance use and rate and resources, Greene County is lower in most of these areas compared to the state, with treatment providers, facilities for treatment, much higher dispensing rate of opioids than the state and the county, but a lower overdose mortality. When we get to access to care, asking about how satisfied people feel with the healthcare opportunities available in their area, Black adults responded as being more satisfied with available opportunities, as well as men being more satisfied than women. In terms of barriers to care, cost was listed as the main one, with the overall average of the survey being about 32%. But for households making 25 to 35,000, that goes up to 57% of them having issues with cost for care. For any households making below 100,000, it was higher than the average, and vice versa for those making above 100,000. Scheduling was also a notable thing listed, with women being much more likely to list scheduling issues as a barrier to accessing their care compared to men. Focus groups also listed things like system complexity and just not being aware of the resources available to them as barriers to their care. Looking at STI testing, young adults comprised the majority of the respondents seeking testing for STIs within the last year. And when we look at mammogram and prostate-specific antigen testing, especially looking at it by income, as income increases, mammogram usage tends to also increase, but the same pattern doesn't necessarily hold for prostate-specific antigen testing. And it's important to note with this that this is looking at women above 40 and men above 50, since that's the recommended ages for people to get these tests every 2 years. Looking at barriers to specific types of care, for pretty much all care types except routine care, cost was listed as the main barrier, with cost being number 2 for routine care, followed by things like not having time or not having insurance coverage. For mental health, system complexity was also listed as a reason for not seeking care. When we get to food access, we see that food insecurity rates over the last several years in Greene County have overall increased, with this increase primarily being seen in minority populations. specifically Black and other Hispanic and Latino populations, whereas the white isn't necessarily affected. Access to healthy foods, perhaps unsurprisingly, increases as you make more money, and adults above 65 are more likely to believe that there's healthy food accessible in their community. And looking at cost as being a barrier to accessing healthy foods, women listed cost as a barrier more than men, as well as young adults listing it more than older adults. Notably, the 25 to 35 income households are disproportionately affected by food costs and their availability to access healthy foods, which likely has something to do with federal poverty thresholds and eligibility for programs like SNAP and other assistance. And looking at how Greene County compares to Ohio, we have lower food insecurity and lower SNAP usage, but for households in poverty, less of them are able to receive SNAP benefits, and Greene County also has less retailers and general grocery stores per 10,000 people than the state. Looking at health behaviors, we see men are much more likely to get the recommended 30 minutes of exercise at least 3 days a week than women are, with women more likely to list time as a barrier to getting the recommended amount of exercise compared to men. And adults above 65 had much less issues with time as a barrier to getting exercise compared to other age groups. Looking at the use of tobacco products like cigarettes, cigars, etc., the average use rate amongst respondents was about 18%, with it being higher in Black adults, in men, young adults, as well as low to low mid-income households. Looking at drinking habits, men were much more likely to have drank at least 7 days in the past 30 compared to women, as well as more likely to have binge drank in the past month, with this being much higher among Black adults compared to white adults. Looking at people's sleep habits and issues that they may have with getting good amounts of sleep, less than half of respondents report getting 7 or more hours of sleep a night, with Black adults being much less likely to get 7+ hours than the other race groups. In addition, those with a high school diploma or less were much less likely to get the recommended amounts of sleep. Over half of women listed stress as a barrier to them getting that sleep, which was lower in men. And looking at the causes of people's sleep issues, stress is by far the highest one, followed by things like temperature, disruptions, noise. In maternal and child health, 42 of the 745 respondents to the survey said they'd been pregnant in the last 3 years, so this information is based off of that. And looking at pregnancy behaviors for those women, the majority of them did note taking prenatal vitamins and receiving prenatal care in the first trimester, but significantly less actually received WIC services, and 12%, which equates to about 5 of the respondents, noted smoking during their pregnancy. Looking at stratification by education, those with a high school diploma or below were much less likely to go to receive prenatal care than all other education groups and take prenatal vitamins. Looking at chronic diseases in the county, in terms of those people who have been diagnosed with in the past year, arthritis was the highest one, followed by obesity, with others like COPD, autoimmune, cancer, and cardiac diseases. And when we look at how Greene County compares to the state and the country, Greene County does better in terms of diabetes, diagnoses, incidence, and mortality, but worse in incidence and mortality for heart disease. Whereas for cancer and stroke, we have a better incidence rate, but worse mortalities, as well as slightly different high blood pressure and obesity rates to the state. When we look at socioeconomic factors, asking people about the availability of well-paying jobs in the community, how available they feel they are, those with an associate's degree were significantly less likely to feel like there were well-paying jobs than other education groups. In addition, men were more likely to feel like there were well-paying jobs than women. And when asked about how they feel their community is aware of resources that are available and transportation options that are available to meet people's needs in the community, men responded much higher to both of these areas than women did. Asking about the perception that there's affordable housing available in the community, young adults were the most likely to feel like the community has affordable housing, even though in focus groups, there were several mentions of challenges with housing that doesn't necessarily seem to be a priority. Looking at those that own versus rent their house, about 38% of those 18 to 39 own their house, with the same percentage renting, whereas for middle-aged and older adults, ownership is much higher and renting is much lower. And looking at renters by income, the 35 to 50,000 income households are by far the highest rental groups compared to other income. And when we look at people believing their community has transportation options available, Black adults were much less likely to believe that this is the case compared to other race groups, with focus groups noting that the county needs more transportation options besides things like green cats, as well as mixed opinions on opportunities for active transportation like biking paths and walking. And some other things noted by focus groups were things like wellness centers being available, but being underutilized due to lack of awareness. So advertising the resources that are currently available would be better. Places people get their information, things like their local church, Facebook, and sometimes their local libraries for things like events ongoing in the community. And these are all the places that some of the aforementioned data came from. Any questions?
Yay, data.
I know that was a lot, so feel free to reach out to me if you have any detailed questions about anything. I didn't want to cut anything out necessarily, so.
I do have one.
Good hand
I
up.
wrote it down because it's so much, but I would have forgot it. But what does system complexity mean when they're talking about just the mental health services? Like they're hard to navigate, it's not available.
Essentially, yeah, like knowing where to get services, how to sign up, if you're eligible, what your options are, that sort of thing, just not knowing where to start. Okay.
I'm just going to talk briefly about the strategic plan. We are getting ready to enter into that process now. We do our strategic plans here every 3 years. And our strategic plan aligns with our CHON chip and the SHIP that I showed you earlier. Also our QI and our quality improvement and performance management plan, as well as our workforce development plan. The 2026 organizational goals for the agency will be participation in and completion of our CHA, CHIP, and strategic plan, and then participation in and the completion of an organizational AI assessment that we will be conducting. Well, Bob will be. And then this is just kind of an overview of our process. It'll start next week, actually, as we kick off with like a fun team building exercise that we're going to do at our all staff lunch and learn. The main takeaways here is that we conduct surveys for this, and I ask the Board of Health to do a couple of those. So those will be coming to you from Olivia via like a Microsoft Forms. So definitely be on the lookout for that. I love to get your input and everything as we move into this process and help pick what our strategic priorities will be over the next 3 years. And then that is all we have. So does anyone have any questions for me or?
Questions for either Lily or Justin? Oh, I have one. I might have the date wrong. The meeting that's April 22nd, I think.
Yes.
Is that something like the one that we could go to? And
Yes.
some of the board went to the one on, what is it, March 17th,
Mhm.
whatever it was. What's the April 22nd one again?
So that'll be, that is open to everyone. So
Okay.
everyone's welcome to come. And that is where we'll be diving more into those priority areas that we identified with that Mentimeter at the end of the
At
meeting.
the end of the other meeting that we went
Yes.
to. Okay.
So we're gonna look a little bit, we're gonna divide out into work groups and we'll look a little bit more at the data and see if we can like pull any strategies or anything
Okay.
and really nail down what those priority areas are. So, yeah.
And then I'm curious, what could you tell us about what the AI assessment will be like?
Sure.
Thank you.
So, Bob will certainly be a part of it, but actually it's an initiative that we're doing agency-wide where Bob and the rest of leadership will be meeting and assessing kind of our data workflow and how we can integrate the usage of AI into some of the work that we do so we can work smarter, not harder. So we are going to be doing that throughout the year and hopefully be able to incorporate that into our strategic plan and phase in the integration of using AI while hopefully phasing out some maybe processes that are kind of outdated now that we can kind of replace or take advantage of AI. So we plan to integrate that probably over the 3 years of our next strategic plan, but this year is just simply meeting as individual teams and going through all of our programs and our processes and then working with Bob to kind of have an output of an assessment.
Thank you. Anybody else? Okay, thank you both very much.
So much. Thank you.
So next, now again, we're into the finance section.
So we did not put the finance report on your iPads. So if they logged out, it's okay. You don't need them right now for the finance reports. So your finance reports are still in paper format. So we'll just go through those like normal. So your first report is on your big white sheet of paper. That's your income expenditure report. So we are a quarter of the year all the way done. Hard to believe. So we are 25% through the year. And that would be kind of that loose metric we would use when we're looking at revenue and expenditure. So we'll start with revenue up at the top. And always going to look at the fund that we rely on for the most revenue, which is going to be 063. So that's halfway down. That's your general health fund. That's where our property tax revenues come in. And you can see that it's relatively large for this time of the year, but it's consistent with the previous 2 years. That's because this is when we get the first property tax apportionment from our levy. So you can see that money has come in and we're right around where we've been the previous 2 years. And then our next largest fund is 037, which is third from the top. And you can see that right now it's 51% collected in terms of what we've anticipated for the year. Also keep in mind, if you do remember from last month, we've been moving a little bit of money around, and I told you this month you would see some money go back into some funds. Some money went back into 037, was part of that 900 some odd thousand that we transferred last month. So 037 and 039 got some money put in them from those transfers. So that percentage is a little inflated is where I'm going with that. But overall for revenue, we're at 61% for this point in the year. And remember, that doesn't mean that we're just going to obliterate what we think we're going to bring in. We're very seasonal in how money comes in. So we just got the first property tax apportionment, which really increases our revenue early on. And then we have several programs that are front end loaded with the money coming in largely of some of our environmental health programs. But overall, things are good there. Expenses moving down to the bottom, you can use that 25% a little bit more accurately as that litmus because our largest fixed cost is people. So we'll look at 0063 as our largest cost center. We did just transfer some money. So when you transfer it, it shows up revenue on the top, expense on the bottom. So that does look relatively large because we did the transfer. So that's why it's at 46% of our total budget already expended. That will normalize as we go out through the rest of the year. No need to be alarmed there. And then our next largest fund is 037, which again is your third from the top. And it's at 34%. And that's largely because we just paid one of our larger annual bills. We paid our liability coverage insurance, and that gets cost allocated through all the funds. So it picks up the second largest portion. So that will normalize as we go out through the rest of the year too. So overall, we're at 34% expended, but remember, we just paid those transfers, those other funds, and we just paid our liability bill or our liability insurance bill. And if we move all the way over, we get those financial health indicators over there. And you see those funds, which ones we're covering their expenses and which ones aren't. If they're in red, that means you're spending a little bit more than what's going in there. To be expected for the beginning of the year, because a lot of that money comes in later. And then with any money that we transfer from property taxes over to those funds, we have not done that yet. But overall, we're at 74%, which is very healthy. If 100% is our target for the organization. So things are still in good shape. Any questions about the income expenditure report? All right. So on your yellow sheets of paper is your voucher summary, but you have that cover sheet on top. And that just shows you the expenses by cost center for the month. And it just shows you what was budgeted for those. These are all your non-labor expenses for the health department and just where we're at right now through March. Overall, we're at 53% expended, but we did just spend 920,000 in transfers. So it does inflate that. And if you were to also look at the insurance line, which is like sixth item down, that's 76,000. You can see that we've already paid that, and that's a one-time expense, but it is in the beginning of the year. The rest of the cost centers are pretty close to that 25%. Some of them are a little bit more erratic because they're not fixed costs. So, but for the majority of them, they're right on track with where they should be. And then if you flip into it, you get the actual detail as you're used to seeing it. So I'll give you a few minutes to look through that. If you have any questions about any specific expense, I'll be happy to answer them.
I like how the font gets smaller later.
We try and deter you for spending too much time in there.
I was doing okay.
Get smaller as you go through.
That is
Yeah.
pretty small this month. So
Wow.
focus your attention on the cover sheet. Any questions about the voucher summary?
Can you remind me what the 035 solid waste Ohio EPA fee is?
Yeah, that is just going to be remittance back. So that's going to be a state fee that we send back. Portion of what we get revenue gets passed on to the state.
Right, but what is that one specifically for?
Shadrick would be the best person to answer that, and he had to dip out. It's just the transmittal for the service. So we get a portion of that in via revenue, and then the state gets their cut back out. So
yeah.
I can have.
I'm familiar with the food one, obviously. And
it operates.
And all that. But,
They all operate in that same methodology. And next month I can have Shadrick explain it. So so he can say exactly what is part of that.
Okay.
But yeah, the process is the same as the state's portion of what we collect.
Obviously, I would also want to know for that.
Oh, yeah.
As far as EPA covering us, we've used them in the past. I'm
Yeah,
curious.
for sure. I'll make a note of that to have Shatter talk more about that next month.
Thank you.
Any other questions? Okay. And then your last finance report is your appropriation transfers, and that is on your salmon colored sheet. And that's just the movement of money into line items to pay bills. Obviously, your largest one on there that stands out is going to be that 920,000 that we transferred into the transfer line so we could move it. Any questions about the appropriation transfers?
Thanks, Noah. So, there are any questions? We go ahead and have a motion in a second to, move that.
Still moved.
Second.
Second.
All of you in favor, say aye, please.
Yeah.
Anyone opposed? Motion passes, thanks. Next, I don't believe, there were any, of these committee meetings in between, but just double checking governance committee,
No report.
performance evaluation.
No.
And planning, and finance. We had met last time, so, okay. The next up, we've got the old business and the home visit inspection policy that we had, seen before, had some questions about. And it went to a legal review and we got to see some of their input and the status of it now. You wanna?
Yeah, I mean, you should have, if your thing is live, if you scroll down, you would actually have both versions, but
Yeah.
it would have been in your original packet that Olivia sent out. So you would have been able to see what small tweaks were made when we sent it out for legal review. Nothing really altered or changed what was originally presented, just a few minor tweaks. So you have a draft that's been legally reviewed that we're just asking for you to approve.
Anybody have questions or discussion about that now that there's been the legal review and input?
Motion open.
Second,
Second.
thank you, everybody, say aye. Any opposed? Okay, that passes. Thanks for following up on that. I think it does feel good to have.
No problem.
Okay, next for new business, we've got a resolution of appreciation for Dave Thompson. So I'm going to just go ahead and read it. The Greene County Board of Health wishes to recognize and commend David Thompson for his leadership and service to the Greene County Board of Health, Greene County Public Health, and the Greene County community. Whereas the city of Xenia appointed Mr. Thompson as representative to the Greene County Board of Health effective February 13, 2020. And during his tenure with the Board of Health, Mr. Thompson served on the Planning and Finance Committee. And Mr. Thompson's loyalty to the Greene County community during his service with the Greene County Public Health and Greene County Board of Health has provided an incredible example of public service. So be it resolved by the Greene County Board of Health that one, the Greene County Board of Health wishes to express its appreciation for Mr. Thompson's 6 years of service on behalf of the Greene County community and Greene County Public Health. And second, that a copy of this resolution will be sent to Mr. Thompson as a small token of the Greene County Board of Health's appreciation for his faithful and dedicated service. So if I could have a board member move for the approval and a board member second.
I second.
Okay, you got that. And then the motion will be carried by acclamation. And we thank Dave Thompson very much for his service. And then you'll tell me if I need to do anything else before consent or, okay,
Nope.
Thanks.
So we need 2 representatives now from Xenia.
Yeah.
Do we have any prospects?
Not at the moment.
Yeah.
We've been in pretty constant communication, so I know they're working on it, but we don't have anybody yet.
Okay, a few additional business items just to note. We received a congratulatory letter from CDC regarding our FAB accreditation. So that's just
Yay.
another way to acknowledge and feel good about that accomplishment. The 2026 Greene County Public Health Employee Appreciation Breakfast, Service Awards, and Employee Meeting will be on Thursday, April 9th at 8:30. Is it in here? In this room, and board members are always welcome to attend that if it works for your schedule. It's fun when you can, I think. NALBO's 2026 Virtual Governance Symposium begins May 13th. There's a list of some of the different speakers. That's something that's available to us as a board virtually. And will you be sending out?
Yeah, so I started the process to get us registered, and then once we have that information, I'll
Great,
send
then
out the
send
link.
it out. Thanks, that's always helpful.
And those are recorded
Mhm.
so that if you can't make the actual call, you can go back into the Nalvo website and listen to it at your own leisure.
Thank you, Nancy.
Yeah,
Our
good
NALBO
findings.
representative in the room. And then, I'm with Dr. Sheraton here. I don't know if there's anything that you feel you want to share.
Just a couple little things maybe is that, I didn't think in April that I would be talking about respiratory viruses, but it, seems like it's all I talk about. But I've had several people ask me about the cicada variant of COVID. And, so when I first heard of it, I thought, that's odd. So I got the basically, this latest variant that's become somewhat active in 25 states is actually a B variant that's been present since 2024, but not active. And so it's been identified now for over 2 years, but now, for whatever reason, it has become the most active variant. So they call it the cicada variant because just like the cicada, it was dormant for a period of time and now it's active. So that's how that came to be. The severity of it really isn't any more severe than the other variants. I guess the biggest thing right now is epidemiologists are looking at it and are feeling like that this variant will be the active variant for the summer months. Now, COVID, unlike some other respiratory viruses, has a surge usually or has a season in the summer where it becomes more active. And so they're speculating that this variant will be the active variant this summer. And as such, they called it the cicada variant. We are seeing, though, a fairly robust RSV season late. We're seeing quite a bit of RSV, and we're seeing it at the office today. And it's active. Now, RSV's been around forever. All of you have had it. We've been exposed to it at one time or the other. And it just depends on an individual's immunity to the extent of the illness they have. So for those individuals that don't have a lot of immunity, they'll have a more severe case of RSV than someone that might have more immunity. So there are some antibodies that have come out now for treatment of RSV. There is a vaccine for RSV, but we're seeing a lot of RSV right now, more than what we would expect for this time of year. And so hopefully next month I will not be even mentioning viruses. I will say one little.
That is that.
I will say one thing is that I was thinking about it is that this week Noah and I attended a meeting together, the Child Death Fatality Review Committee meeting, and that actually is a committee that meets under the guidance of the health department. It's a health department guided meeting, and long story short, each jurisdiction in the state of Ohio is responsible for reviewing child deaths, submitting a report to the state that is then put together at a state level. Each local committee is also charged with the responsibility that if you, as at the local level, if you see something that stands out or anything that would be preventable, that committee has some authority and responsibility to look into that and enact or initiate any kind of changes that need to be made on the local level. So we had our Child Death Review Committee. Bill was very active into it as the administrator of it when he was with us at the coroner's office. And like I said, technically it is a committee by the health department. It's just something that we've been doing at the coroner's office in conjunction with the health department. We submit that report, it goes up the line, and then there's a statewide report about child fatalities across the state of Ohio. So as I got to thinking about it, over the years, I really never ever mentioned that to the board here about the Fatality Review Committee. So if you have any questions about it, want to learn more about it, we sure share that.
Do we ever see any of the data?
The data is reported in a yearly report. It's presented, I think, at one of the semi-annual meetings. There's usually, I think, a section, somebody reports it out. It's public record, so it's available. Have you seen the statewide report?
No.
Okay, it exists. That's a good question. I'll look it up.
Is this a county committee or is it?
So it can be different. We had 12 deaths last year in 2025. And a child death is any death from birth until 18 to 19 years of age, so through the 18th year. So last year, 2025, we had 12. Now Montgomery County, and I don't know, I'm just speculating, but they would have hundreds. So they meet much more active than we do. We're required to meet at least once a year. So.
And that is normally the deaths for Greene County is 20 some. And if he's only had 12 kids, that is really great.
Yeah, last year, for whatever reason, was way down, less than half of what we would normally have. It's not unusual for us to have close to that many traffic fatalities in a year.
Yeah, yeah.
Thank you very much. Anybody else have anything they feel important to share?
I love these computers.
All right.
So whoever did this, I love these.
Well, we appreciate that. Hopefully it wasn't too painful tonight. Olivia and I will we'll work on some formatting things and hopefully we can do something about this.
I have to keep putting my.
Yeah, if we could extend this time, that'd be awesome.
It's going to that, or you just gotta keep touching the mouse pad.
Yeah, it's good. We keep on with this.
I just have one thing. I was, when you guys were giving the report about the community health assessment, I had just gotten an email from Linkage. Are you guys on that Linkage group? Well, anyway, it links different communities here in Greene County. And so Shannon Webster from Green Cats said that Green Cats is desperately looking for some public support. And they're talking about cutting their hours down. They have them quit running at 6 p.m. versus 10 p.m. It looks like the trips are gonna double. And yeah, looks like they're in a lot of trouble. Anyway, I could share it on my, says a lot more than that. They're gonna eliminate the flex route, reduce weekday service hours from 6 a.m. to 10 p.m. to 6 a.m. to 6 p.m. Convert 2 scheduled ride runs to same day on demand.
Is there a major funding source that's been lost or
Or, is it lack of usage?
or is it, yeah.
Well, I think part of it, they're doing some kind of studies about usage.
Well, if you want to, if you could share that maybe like with Olivia
Yeah,
or,
if you email
because
me, I
then,
can share it with
yeah.
everybody.
because especially with transportation being in the ship.
Yeah.
And it is one of your major social determinants of health.
Absolutely. It's
Yeah.
Yeah,
important.
thanks.
They're talking about charging per mile and stuff now. Anyway, I'll share it.
Thanks. Okay, yes.
The only other thing I have is, I love these computers, but can we have a tablet and a pen? Because like Angie, my thought pattern is not all that good. I need to write things down so I can talk about them later on. So if we can have a pad or a pencil.
Okay.
Or pen or something, that way I can, when you ask the question, then I can speak on those. Because as the young man and young lady was talking, I thought of different things, but of course, my mind is not as clear as it used to be. Come on, Nancy, you know what I'm talking about. Not as clear. So it just went down the road.
So if you have a pen, I mean.
Yeah, if I can write it down.
You could use the back.
Well, yeah.
And then you, yeah. Cause I scribble, I couldn't remember to.
See, I know.
Yeah.
I think we can handle it.
Yeah.
Thank you, thank you.
Good point, good point.
Thank you, because on the computer, we can't do anything with that. But
Lost, yeah. Yep.
makes sense.
Thanks.
Thank you very much.
All right, thank you all so much. Everybody keep doing your best, getting through spring, and we'll see you next time. Sooner if you come to one of the interim available meetings. So we're.
Nancy, the OVH website has all